Welcome to all students. Today we will be seeing a class on history taking of sinus. History taking of sinus, ulcer and swellings are very basic case history components that will be taught in the third year BDS, and they will form the basis of your final year case history taking for short and long cases. What is a sinus? A sinus is a pathological tract which is lined by epithelium, and it connects a pathological cavity to the exterior or interior part of a soft tissue or a bone. If any pathological changes are occurring in a particular area, there is destruction leading to formation of necrosis, and there is a cavity formation over there. This cavity contains lot of pus, cystic fluid, polymorphonuclear cells, and necrotic tissue. And this fluid, when it accumulates in the pathological cavity, it starts to perforate the soft or hard tissue through the path of least resistance, and it comes out through an opening. If the opening is in the external surface of the skin or mucosa, the surface epithelium over the opening forms a tract, and this pathological tract is formed and it is known as a sinus. Some examples are an opening in the skin in the region of the body of mandible, where the body is affected with osteomyelitic changes, forming a cavity in the base. Another variation of sinus is fistula, but the difference is a fistula is a pathological tract which is also lined by epithelium, but it connects two body cavities. In the body cavities, the opening connects inferiorly to a pathological cavity. For example, a very common fistula that we will be seeing in dental conditions is the oroantral fistula. When the maxillary sinus is infected and the lining of the sinus and the bone is completely destroyed, a pathological cavity is formed in the maxillary antrum, and the pus will perforate the bone and opening, and this will occur intraorally, that is, in the oral cavity in the vestibular sulcular area of the upper molars. This opening, which connects two body cavities, that is, the oral cavity and the antral or the sinus cavity, is what is known as a fistula. Other examples of fistulas are oronasal fistula, parotid fistula, etc. Coming to the basic examination of a sinus. If a patient reports to the hospital with a sinus, it should be diagnosed based on what type of a disease progress is underlying which could have caused the sinus. We should first understand that sinus itself is not a disease, but it is only a clinical sign of pathology of any underlying disease. With the help of the sinus, we are able to find out what is the actual disease process which is going on within the patient's body. Some points which have to be noted before taking the history taking of a sinus are: number one, the duration. If a sinus is present from birth, it is known as a congenital or a developmental sinus. If it is present for a very short duration of time, it could be caused due to any underlying acute or subacute inflammatory condition. If the sinus is present for a long time, or the patient says that the sinus keeps recurring again and again after short bouts of episodes, and in the middle he doesn't have any signs, but suddenly there is sinus formation. When this keeps happening, it could be due to a chronic or a long inflammatory process which is present in his body. Coming to the mode of onset. Now, sinus can develop after trauma. It can also occur after a particular swelling is present for a particular period of time and it bursts, leading to the formation of an unhealed sinus. It can develop after a surgery also as a result of sutures or as a result of approximation of the tissues which occur after the surgical wounds are trying to heal. It can also develop due to developmental deformities. Coming to the type of discharge that you can see as a result of a sinus. Normally, in the dental OPD, we are able to see the pus, which occurs as a yellowish white fluid when we give mild pressure to the area of presence of sinus. Now, it can also be tinged with blood. So, blood tinged pus can be seen. Sometimes, simple fluid material can be seen, which is clear in color. It could be transparent, it could be watery, it could be mucinous, or it could be yellowish in color also. Sometimes, bony spicules and small pieces of infectious tissue or granulation tissue can also be seen inside the sinus discharge. Coming to inspection, the number of sinuses have to be taken into consideration. Whether it is a single sinus or multiple sinuses are present in the same place. Single sinus can occur when there is an infection of a single tooth or one or two teeth. Multiple sinuses are very common in certain chronic granulomatous diseases like actinomycetes, where the patient gives you a history of multiple sinus in any part of the jaw, which has been present for a long period of time, and it keeps coming back again and again after he takes a regimen of antibiotics. So, this is a very common finding in chronic granulomatous diseases. Coming to the site, where does the sinus occur? If it occurs in the submental region, it gives us an information that the sinus could be related to an infected lower anterior tooth. If it occurs in the angle of mandible, it could be related to an impacted tooth. If it occurs as a congenital sinus, it could be from the ears, a preauricular sinus. And if it occurs in the midline of the palate, it could be a result of a non-vital or a tooth in the anterior region which had undergone a trauma a few years ago, leading to a presence of sinus from the periapical region of the non-vital tooth. Coming to opening, we also have to check the opening of the sinus, whether it is broad or narrow, and whether it is containing the granulation tissues. And we also need to check for the surrounding mucosa or skin to see if there is any secondary changes like ulcerations, pigmentations, any discoloration, any blood discharge, etc. Finally, coming to palpation. The first point to be considered while palpating a sinus is whether it is painful or it is not. And when you keep applying pressure to the area of sinus, whether there is pain in the associated teeth which are present right next to the sinus. One important test that we often do while examining a sinus is the Gutta-Percha test, which helps us to find out the sinus tract and the source of infection, wherein we insert a small GP point, which could be 15, a point number 15 or 10, into the sinus tract, and we are inserting it as far as possible and taking an IOP of that region, and we'll be able to find out where exactly the tip of the gutta percha is going. So if it is reaching to a particular tooth, it means that the sinus tract has occurred following an infection or a periapical infection from that particular tooth. So this is a very important and a very common test that we can do in the OPD. Otherwise, we can also go in for a FNAC, fine needle aspiration cytology, where intraorally, if a swelling is present, we can go in and take a broad gauge needle and take the pus by using the normal needle. And we can take out the aspirate and check for the color, the consistency, the type of fluid that we have collected, which will help us to get an idea of the underlying disease condition. Thank you.